Hi. Imagine you're nearly 37 weeks now, what we would call term pregnancy. So in your 9th month of an uncomplicated pregnancy. The commonest question we get around this time is, Doctor, when should we contact you? What are the symptoms for which we have to call you up, or at least reach hospital? So this particular capsule is going to cover this very important topic. So essentially there are 4 complaints for which a lady should either contact us or she should reach hospital depending on the arrangement you have with your doctor. They are watery discharge, a bloody discharge, labor pain, and the 4th one is decreased fetal movements. So we'll look at all of them one by one. So coming to the first one of watery discharge, our baby is surrounded in a bubble of water, sort of like a balloon. And this water is what we call amniotic fluid, is about a liter in quantity around term. Of course, it can vary. And sometimes, in a small percentage of patients, maybe not more than 10 to 20% of cases, the amniotic membrane bursts and the water comes out. Now this is very dramatic, and probably the reason why you see it often in movies rather than in real life, but it can happen. So the amniotic fluid at term is about 1 liter in quantity. It can vary from pregnancy to pregnancy, but the water or the amniotic liquor or the amniotic fluid is just like water. And so if the membrane ruptures and the water comes out, you are going to get wet. And you'll have water dripping down and onto the floor, completely drenching your undergarments or your bedsheet. Whereas a typical vaginal discharge, which can increase during your 9th month of pregnancy, is going to be more sticky. It's going to be less in amount, and it may stain your undergarments, but it normally would not wet it completely. So that's how you differentiate between a normal vaginal discharge at term and the amniotic fluid which you can leak out at term. The amount of water which leaks out depends, of course, on how much of water you have surrounding your baby, which varies, and also depends on whether your baby's head is well placed inside the pelvis. Because if the baby's head is well placed inside the pelvis, sometimes the baby's head will work like a plug and may not allow all the water to come out. So that's possible that you may have a little bit of watery discharge and you could still have actually opened out the water. And if you have watery discharge and you're not sure whether it is a vaginal discharge or not, let us know, come to hospital, we'll have a check and then let us make that call. And if it is a vaginal discharge, we'll send you home. But I would rather you be safe rather than sit at home and brood over it. The second element of discussion is the bloody discharge I talked about. Now this is what we call as show. Now in preparation for your delivery, your uterine mouth, or what we call the cervix, prepares itself for delivery. And how does it do that? Well, it prepares by softening down. And the softening down of the cervix starts well early, maybe around even as early as your 8th month. But just around your delivery time, maybe a week or so, the cervix or the uterus mouth does something else. It starts to shorten down. And as it shortens down, the cervical mucus plug, or that mucus which is normally situated within the cervical canal, it can come out. And the cervical mucus plug tends to look just like a sticky mucus, and it will have blood streaks on it. Now this tells us that labor is around the corner. Now it could be you could go in labor tonight, or you could go in labor maybe a week from now. So that's the issue with show. It doesn't tell you it's going to happen immediately, but it tells you that stuff is happening and good things are happening, and your cervix is preparing for your delivery, and that's not a bad thing. But you should inform us if that happens, whether you want to call us or you need to just message us or you'd like to reach hospital. I leave it to you and your doctor's arrangement. But yes, it's something which we would like to know. However, if at any time you have actual bleeding, and I'm talking about menstrual bleeding type of flow, you need to inform us immediately and you need to reach hospital immediately. And that's something you have to be aware of. Bleeding, reach hospital now. Show, well, probably you can inform us or reach hospital. But bleeding is something we take very, very seriously at any gestation and especially at term. The third aspect is the very famous labor pain. So as soon as you note that there's some ache coming along, look at the clock and note the time. And wait for your next labor ache to come along. And if that ache comes at a particular time, note it down and wait for the next labor ache to come along. And nearly always it will come nearly around the same time. So if you have around half an hourly intervals between one labor pain and the next, well, that tells you that the rhythm has established. Now with time, you'll notice that the labor ache starts becoming more painful and it gets more frequent. So initially you were getting an ache once every half an hour. After a couple of hours, you'll notice that it comes every 15 minutes and this ache would be probably a little bit more painful. And an hour or two after that, you'll notice it comes every 10 minutes. And then it will come every 5 minutes. And then it will come every 3 minutes. So this is the hallmark of labor pain. So when should you contact us? So if you get a contraction coming once every 10 minutes, I would suggest my patients to let me know. When should you reach hospital? Well, depends on your case, as also how far away from the hospital you stay. So if you stay close by, well, you could come to hospital when you get a contractions, maybe 2 in 10 minutes or 1 in 5 minutes. In some countries, they ask you to come to hospital only when you're getting 3 in 10 minutes. But where I stay, I normally ask my patients to contact me when you get 1 contraction in 10 minutes and try to reach hospital by the time you get 2 in 10 minutes. Now remember, after you get contractions for 3 in 10 minutes, you still have probably anything between 4 to 6 or maybe 8 hours more before you deliver. So it's important that you don't panic. Don't delay, but don't panic. If there are any complicating factors, then again I would ask them to come as early as you possibly can, maybe 1 in 15 hours. So you need to talk with your doctor and find out exactly what your doctor or hospital warrants. Remember, if you are going into labor and you're getting a contraction regularly, one thing we do not want you to do is have a heavy meal before coming. You probably drink some water, but generally we would suggest you come as is, as the way you are, and let us examine and check, and then we'll ask you to eat or not to eat depending on the situation. So the last aspect of discussion is the baby movements. Now this has usually nothing to do with labor pain or onset of labor, but it's an important parameter which you can monitor on your own to assess your baby's well-being. There are many ways to check a baby's movement. One is known as a CARDIFF count. Another one is known as a DFMC, or a daily fetal movements chart. So I ask my patients to keep the DFMC chart, or the daily fetal movements chart. So a daily fetal movements chart is very simple to keep. You just need to count the number of movements or kicks your baby does in 1 hour, 3 times a day. So typically we ask you to count 1 hour in the morning, 1 hour in the afternoon, 1 hour at night. Usually we ask you to count after your meals, your breakfast, lunch and dinner. And tabulate the number of movements you have in those individual hours. Important that you concentrate on your movements when you're counting, and we would suggest you lie on your side and count your movements and tabulate it. Now at the end of the day, you'll have 3 hours of tabulated movements, and you can total it up if you wish. And if you do this every day and you tabulate it and you write it down clearly what is your movements over the whole day, 3 hours in a day, 3 well spaced out hours in a day, then you have a benchmark which you can compare with. For example, if you have around 30-40 movements per hour on say Monday, and on Wednesday you find that your baby is kicking maybe around 5 to 6 movements in an hour, then maybe it would be a good idea to contact us. But if the movements are more or less the same, then your everything is doing very well. It's important to remember that babies have their own moods, their own play time and sleep time. So sometimes babies just don't move at all for a long time. And I understand that sometimes keeping a movements chart can make patients pretty paranoid and occasionally panic. So don't worry, don't panic. If you feel the movements are not good, contact us, reach hospital. We will do a test known as an NST and confirm that baby is doing well. Invariably, by the time you reach hospital, the movements would be back to normal. But I would any day prefer that you get a checkup done rather than worry at home. Please understand, in a complicated pregnancy like hypertension or previous cesarean sections, there will be specific advices which your doctor will give you. But for an otherwise uncomplicated pregnancy, these 4 things, that is watery discharge, bloody discharge, pain, and decreased movements, would be the typical complaints for which I would ask you to contact us or reach hospital. Remember, bleeding is something which you have to inform us immediately, and any severe pain you need to inform us immediately. So in my next capsule, I'll be discussing the birth plan. Alright, so I'll be seeing you soon. Bye.